My name is Maureen. I have had an abdominoplasty last October with Dr. Hubbard, and then this past October I had a partial facelift done. I would have never had the facelift done if I hadn't had the abdominoplasty, because Dr. Hubbard made that such a powerful, positive experience. I thought I wanted to go forward and go ahead and get the facelift done next. Initially, I had been diagnosed with breast cancer, and I had lost a great deal of weight because of that. And unfortunately, after you reach a certain age, your skin doesn't go anywhere. You've lost your elasticity. So I had this rolls of skin on the torso. And my best friend had plastic surgery with Dr. Hubbard the year before. And she said, you should go talk to him to see what he can do. And that's basically that was the whole motivation. I had all this excess skin, and I came to see him, and I felt so good about talking to him. I was over 60 years old. I'm a diabetic. And certainly, you know, I was concerned about my age, but I knew I was in good shape. I knew I was healthy, and he was so confident that together he and I would tackle this. And I would be successful. He even calls me his star patient because I recovered so quickly from the abdominoplasty. So after I had the tummy tuck done, I healed for a year. And the second part of my recovery was my face, because I had lost all this weight. The skin was just hanging. I said I had chins, not one chin, but all of it was a good thing because I had lost weight. So I came back to see Dr. Hubbard, and he said absolutely he could help me with that. So I had a neck and the chin lift. And the best part, I gotta tell you, was he did fat injections on my face. Absolutely the best, part of the best procedure, because as the swelling went down, my face still stayed younger and firmer, because the fat injections are an amazing process. Totally painless. I had no idea. They did it the day. They do a little liposuction, they process it, and then they inject it back into your face. It's your own body. You know, it's your own genes, it's your own cells. So you don't risk, you know, rejection. There's very little side effects, and it's a phenomenal part of the plastic surgery, especially the facelift procedure. And I would tell anybody who was going to do that, go ahead and get the fat injections done too. It's almost like part one is, I think, the removal of the excess skin, and then when you use a fat injection, it fills it back up again. So you know, you come out looking, I tell everyone, I said, I knew I wasn't going to look 20 again, but gosh, I feel really good for 60, you know, and that's what I told him. I said, I just want to be fabulous at 60, that's all. And I ended up being so much more thanks to him. It's not about looks, it's about what you feel inside about yourself. It's more. It's more than just looking in the mirror and saying, oh, you look good. That's not what I say. You know, I look and I thank goodness, because now I think I look like I feel. You know what I'm saying? I feel fabulous, and now I think that's how I look. Absolutely, yeah. I wouldn't even think twice now. Yeah. We met for the first time, and I knew right away he was the one. It was very straightforward. He's a very straightforward physician. This is what I can do for you, but I won't put you at risk. He probably gave me back a lot of joy that I'd kind of lost track of. So by having this procedure and having his faith in me and having all the wonderful staff out there that stood by me through both procedures, but thank you seems inadequate to say to people, but from the bottom of my heart, he's changed me in a positive way. And I think that comes, I I take that joy he's given me, and then I return it to others.